Hello, everyone. Thank you so much for joining me today in this interview. My name is Ricky Watson, and I'm an adult mucormycosis patient of Dr. Pappas from UAB Hospital. There's a link to that interview for any that may be interested. Today is a continuation of a series called The Learning Lounge, patient-led talks with fungal experts. The main focus with this discussion is mucormycosis in pediatrics. Our experts answering questions and giving us insights is Dr. Antonio Arrieta. He is a division chief of pediatric infectious diseases at the Children's Hospital of Orange County in California. Dr. Arrieta, thank you for making time to be with us and for the life-saving work that you do every day.
Thank you.
We also have two very special and courageous guests with us today. Kennie Avendano, who goes by Kenny, and he's with his mom, Shendi Hernandez.
Hello.
Hi. Thank you, guys. Kenny is a patient of Dr. Arrieta's, and thank you both for being here.
Thank you for having us.
Kenny and Shendi, please tell us about your experience with mucormycosis. And Kenny, if you would you like to share with us first?
To be honest, a lot of my history with this fungal disease is very hazy because I was going through lots of other things at the same time. I only know from what I've been told, but I know this led to me getting a lobectomy, right? Because I had it in my lung, and I know that I had to get my spine. I had to get support in my spine because my spine was close to collapsing due to this fungus. And T9, T10, and T11 now have titanium rods and screws to hold my spine up due to the effects this fungus had on my spine. That's all I can confidently say because I was not doing well at the time.
Right. Well, that's amazing. I mean, to see you now and everything you've been through with that, you look amazing, Kenny. You really do.
Thank you. I appreciate it.
Yeah. Ms. Shendi, how can you go into kind of the caregiver of kind of the things that you did for Kenny while he was going through these things, and you also?
I do remember. I remember I was told that he had an infection, and as Kenny mentioned, he had a lot going on with him. I didn't know how serious this infection was until Dr. Arrieta came and spoke to me and explained of how serious it is, and in some cases it could be fatal. And of course, I don't know anything about it at the moment. I have a million questions. I'm scared, terrified after hearing of what it could do to a human's body. And it was a hard pill to swallow because I was able to see how much damage it could do, and I saw my son go through it and all the pain that it caused. So it was a very difficult time.
Sure. Yeah. Wow. Amazing. You guys came through it, very well from what we can see. You're two beautiful, Kenny looks very happy. You look very happy. You guys did very well. Very well. Yeah, it's kind of how you bring that up, a lot of people, what is this? Yeah, what do I have? Mucormycosis, what? And yeah, I didn't know anything about it either, and they only gave me 30% chance to live, and so yeah, it's definitely a very confusing and fast-paced time of what do we do and what's going to happen next, but we made it. And you guys look wonderful. You look healthy, and I'm happy that I'm where I am today. Thank you for sharing with us, Dr. Arrieta. What is mucormycosis?
Rick, if I may call you Rick,
Yes, sir.
allow me to start before I go into the technical
Sure.
details, how emotional this is for me. Kenny is my buddy. Shendi, if I may call you Shendi, we went through hell and back with Kenny, and they never wavered. Kenny, as he explained, initially had pulmonary mucormycosis early in his transplant, which meant that he was going to be immunocompromised still for a lengthy period of time, which is really a very difficult thing to be going through mucormycosis when you are anticipated to be immunocompromised for a foreseeable future. Kenny is a brave young man. I remember one day we were in the ICU and there were discussions about what to be the next move. And they told me that perhaps I was being too aggressive with the medications I was using and we were seeing some toxicities. And I said, don't mess with Kenny. and,
Yeah.
and everybody laughed a little bit and we kept going. And there were some other heroes, Dr. Lubinsky, who managed a ventilator like nobody else would have dared to do and carry him through the next 2 or 3 nights that were perhaps the most critical ones when he, on top of his mucormycosis, had actually developed disseminated herpes. I can't explain how much Kenny went through. The infection from his lungs spread to his vertebrae, and then from that vertebra spread to the other 2 contiguous vertebrae, and we had to go in through a very difficult surgery. We needed 2 surgeons, one cardiothoracic surgeon to approach the vertebra anteriorly, and then a orthopedic surgeon who was able to go and stabilize his vertebrae. So it just it kind of makes me a little bit teary-eyed when I talk about Kenny and his courage and his mother's courage. She went through this, never hesitated. She was
Absolutely.
awesome. So anyway, now let me
Yeah.
get out of that mode and
Thank you for that. Yeah, definitely.
talk to you about mucormycosis. So mucormycosis is one of the few or several fungal pathogens, microbes, that patients who are immunocompromised are at risk for acquiring. Mucor is peculiar because it also affects other patients who do not necessarily have immune deficiency. Patients with burns, patients with diabetes are also at risk for mucormycosis, patients who have too much iron in their bodies. But the most dangerous type of infection is when this happens in patients who are immunocompromised. Typically, what we call hematological malignancies, such as leukemias, or patients receiving stem cell transplants. So those are the patients who are at highest risk. Is in the US the second most common fungal pathogen in immunocompromised hosts, with Aspergillus being, mold fungus pathogen, with Aspergillus being the most frequent one. Mucor is the most frequently fatal of the 2, particularly when you acquire this at a time when your immune system is not yet up to par. So I don't know if you want me to continue to go or you want to ask different questions at different times.
Sure, no, that's good. Yeah, thank you for that. You know, and that's how I developed mine also. I had a weakened immune system also. And that's how, you know, I was attacked. And it's just, it's amazing to know that normally the body, you know, will take care of this for you. But, you know, it's when you're going through other things that, you know, it's able to get in and then, you know, do what it does, you know. Yeah. The next question I have is there any way to prevent mucormycosis?
So nowadays, there are antifungal agents that have activity against mucormycosis that are not as toxic as the more classic antifungal agent called amphotericin B. We can now talk about the possibility of using some of these agents to prevent mucor infections, but there aren't enough mucor infections for us to be able to say uh, we actually did prevent infection. We would need hundreds of patients to be able to say that the frequency with which it happens in immunocompromised hosts that is somewhere between 5 to 7%, it would be very difficult. We would need hundreds of patients to be able to say that we dropped that risk by 50 or 70%. So at
Okay.
this point, we use agents to prevent other molds, and we often prefer to use those which also cover mucormycosis, although we don't have clear evidence that they would be able to do that.
Gotcha. Okay. Now, what symptoms should patients and their loved ones look for? And then also, like, how is mucormycosis diagnosed?
So once again, these type of infections typically happen on patients who have weak immune systems. So the most common way in which this presents is when a patient who has weak immune system, like Kenny did at the time, he started having fever, and he was already on broad spectrum antibiotics, and all his blood cultures, etc., were negative. So after 5 days of having ongoing fever without response to the antibiotics, we did what is called a CT scan of his chest. And that revealed that there was an area on his left lung that was occupied by something that was giving him an infection. At that time, we sent some workup, and the one that gave us the answer at that time is what is called microbial cell-free DNA metagenomics. It is very well known as Karius test, which is the laboratory where this is carried out. And within 48 hours, we knew it was mucor. So we rapidly started him. At that time, we were studying an agent called isavuconazole. So I approached Shendi to see if she would be interested in participating in this. We knew from data that is supposed to be as good, less toxic. We started him on this agent, and we were not very pleased. So we actually repeated the Karius, which is very unusual. And 5 to 7 days later, the Karius showed to us that actually was higher than it had been when we diagnosed him with. So at that time, before we sent the test, we actually had double the dose of isavuconazole. When the test came back, that the Karius test, the level had gone up. At the same time, due to the surgery we had been able to recover the fungus. And we had sent it out to Texas. As you can see, it takes a village, it takes a world to do these things. So in Texas, they were able to identify the fungus and tell us the susceptibility to different antifungal agents. So we rapidly dropped the isavuconazole and went on the more classic liposomal amphotericin B, which is a less toxic form of amphotericin B that allows us to use this agent with some degree of impunity, but the dose that is typically 3 to 5 milligrams per kilo with Kenny, we were using it at 12 milligrams per kilo because by now it had disseminated to his vertebra. So
Yeah.
I went and talked to Shendi and I said, listen, this is the deal. I may fry his kidneys. There will be dialysis if necessary. There will be kidney transplants if we need to, but I can't lose him. So we went ahead and went to 12 milligrams per kilo of Ambisome. And within perhaps a week or so, we started seeing some improvement of his general status. But then later, we repeated the CT scans 2 or 3 weeks later, and now the vertebrae had spread to the contiguous vertebra. So that's how we diagnosed him, and that's how we started his treatment.
Right. Wow. Man. In your opinion, is there any way to be able to speed up the diagnosis process to where in the future we'll be able to catch these things quicker? Even though you guys, I mean, you moved awfully fast, is there, like, is Texas the only state where these kind of things can be tested at right now?
We trust this particular laboratory very much, but once you trust a laboratory, you stick to it.
Yeah.
Mucor sometimes present differently. Sometimes it can present in the sinuses, it can present in the eye. When that happens, sometimes it goes into the brain. So sometimes it's very obvious what is happening. Sometimes it's more difficult to identify, like it was with Kenny. So depending how it presents, then the speed with which you can diagnose it, and all starts with the type of patients that you're dealing. So if you're dealing with a bone marrow transplant patient whose eye all of a sudden gets swollen, you know what you're dealing with. You're going to go get a biopsy. You're going to go clean and debride that, do surgical cleaning, but that becomes pretty obvious. When you have it in your lungs, when you have it in all organs, then it's much more difficult to diagnose.
Mhm. Wow. Do you know, are there any new like treatments or any new medications that are being worked on or coming out that that to help mucormycosis patients?
Unfortunately, not many. There's two agents, isavuconazole that I mentioned earlier, that has not been compared to the other agents, so I cannot tell you if it's better or worse. It appears to be safer than the other agents. There is a newer agent that is not quite available yet that may have some, but perhaps probably not better than activity against mucor than isavuconazole, posaconazole, or liposomal amphotericin B do. So for right now, unfortunately, we do not have very good agents coming in the pipeline.
Right. Yeah. Well, hopefully that'll change, and I believe what we're doing now will help that, you know.
Well, it is only with patients like Kenny and his mother that we will be able to develop new agents. It
Yeah.
takes a lot of courage to look at the doctor in the eye and say, yes, I'm going to let you. You just told me that my son has a disease that is worse than the leukemia that brought him to transplant, and you want me to take your word and say, fine, go ahead and use that agent. So those are very, very difficult steps to take. So in order to develop these agents, we need to approach patients, and we need patients with the courage that Kenny and his mother had, so that we can get where we want to get.
Right. Yeah. Awesome. What can patients and their caregivers expect after treatment for mucormycosis? Kenny and Shendi,
Sorry about that.
give us your perspective on moving forward in life.
Well, I'm several years out from dealing with this fungus, but
Mhm.
day to day, it still affects me. I have hard time breathing, right? Due to the lobectomy I got. And I have to be careful with my posture at all times and how I lay down and how I sit because my back is more susceptible to like I can hurt my back easier, like just simply being slouched or laying a certain way. hurts because of the surgery I had to get done due to this fungus. So despite the fact that I'm done with it, I'm never really truly done with it, right? So obviously in my case, dealing with mucormycosis is different than if someone else had it. But for me, mucormycosis means means having to catch my breath more. To me, it means back problems, right? And that might not be the case for everyone. So that's what I, you know, tie to it, what I relate to it.
Sure. Kenny, you're a young man, and you still have a very bright future.
Thank you.
I could definitely tell this. You shine through the screen, my friend, and you've gone through a lot, and you're only going to learn, you're only going to grow, and your spirit's only going to get stronger.
I appreciate
And
it.
we thank you so much for sharing. Thanks, Kenny. You're going to help countless others.
I appreciate it.
Dr. Arrieta, do you know what supports are available for patients and families dealing with mucormycosis?
One thing that I wanted to highlight is Kenny is a very humble young man. He is not explaining to you how courageous he was. He didn't get well from mucormycosis from one day to the next. When we had kind of defeated this fungus, we had to deal with the consequences of this fungus. Kenny needed extensive rehabilitation every day. Physical therapy would come and work with him, with his legs, with his toes, with his back. I still remember the day when I was sitting in chalk and what we called 3PQ at the time, and Kenny walked into the PQ, into the 3PQ. And I think all of us who were here, who had been taking care of Kenny all this time, got up and started shedding tears because we saw him walking, and he told us before he left on a wheelchair, he told us, "I'm gonna walk back." So he went through physical therapy. Mom took him to therapy. Where you guys are sitting in front of two real heroes, courageous, brave people who had each other's back all along. There was never a day that they were not there for each other. So now, anyway, from the support point of view, from the outside of all these therapists, and I am sure that Kenny has also gone through countless hours of therapy to try to help him go through the post-traumatic stress disorder of having go through what he went through and come on the other side and look back at the days that he was on the vent, on the bed, on the ventilator. We don't know what that does to a brain, to a child's psyche. So I think all of those, the physical injury is not the only injury. The emotional and psychological stress that somebody like Kenny went through has to be recognized, which we often don't, and we have to work on that. And from my point of view, the most undeniable support that Kenny had was that of his mother, that was by his bedside day in and day out.
Awesome. Absolutely. Wow. Amazing. Just amazing. Guys, finally, just to kind of wrap things up, is there anything that, and this is to all of us, that we can just give to a word of encouragement to anybody that's going through mucormycosis right now?
Um, I would like to say, Kenny had a long stay at the hospital. It was almost a year that at that time, and Kenny was in a coma fighting pneumonia, herpes, a fungus, recovering from a transplant, recovering from the surgery from the lobotomy, the back.
Mhm.
He was in a coma,
Wow.
and for many months, a lot of his doctors, not Arrieta, a lot of his doctors in the ICU didn't think he was gonna make it.
Mhm.
They told me on a daily basis that his situation was getting worse and worse. He was in a coma receiving the treatment for the fungus plus other stuff. He had um his arms and his legs full of lines. You couldn't walk into his room because there was all these machines.
Mhm.
And I I believed God, and I stuck to that faith, and I had a lot of hope as his mom.
Mhm.
And even though no one in that ICU thought he was gonna make it, because that's what I was told, not Arrieta. Arrieta fought. They they would put my hopes down,
Mhm.
and Kenny beat the odds. Even though he was told on a daily basis that they didn't think he was gonna make it. So they have to hold on to any hope that they have,
Mhm.
because miracles do happen. And after knowing of the damage that that fungus does to the human body, all I have is gratitude and a different perspective of life.
Yeah.
So do not give up,
Yeah. Amen.
because it could happen. And Kenny is proof of that.
Yes. Yes, he is. Yeah. Amazing. Yeah. Just as you say, never give up hope. Believe every day, you know. And and for me also, I needed to remember that I was confused, but not only was I confused, but so were my family, all my loved ones, my wife, and I had to learn during those times to be patient with them, be patient with myself, uh, because none of us know the next step, but just to have faith and be grateful for the time and every breath that we do have, and for the family and the loved ones, and for our Creator, because everything is in His hands. And
Yes.
believe and trust in that always.
And those providers that fight for you, and they don't
Mhm.
take no for an answer, and
That's right.
advocate for you. Arietta, we
Mhm.
love you forever. We love you so
Mhm.
much. Thank you for everything that you did for my son, and
Love
watching him like a hawk.
Awesome. Yes. Yeah. Thank you, doctor.
you're good. So welcome. Thank you so much.
Thank you.
Yeah.